I'm Dr. Alina Gerrie. I'm a hematologist at the British Columbia Cancer Centre in Vancouver, British Columbia, Canada, and assistant professor at the University of British Columbia. I focus my clinical and research practice on leukemias and lymphomas, specifically chronic lymphocytic leukemia, or CLL. CLL is, in fact, a cancer of the immune system. The cancer cells, which are B cells, are actually the same cells that are part of our normal immune systems that help us make antibodies so that our bodies can fight off bacteria and viruses. We also need these normal B cells to respond to vaccines, which require us to make antibodies to have an effect. We know that patients with CLL have suppressed immune systems, even without ever having been exposed to chemotherapy or other treatments. And we can even check that by looking at antibody levels, or what are called immunoglobulins, in their blood. CLL patients often get recurring infections, which can be chronic, requiring sometimes multiple courses of antibiotics, or may be acute, meaning they occur really rapidly and could be more serious. And then on top of that, treatment for CLL can also further decrease a patient's immune system and further decrease their ability to fight off infection, especially because the goal of treatment is to get rid of those cancerous CLL cells, but that also means getting rid of the normal B cells, which were required for us to fight off infections. Patients with CLL are at higher risk of more severe disease if they were to contract COVID-19 because they don't have as strong as an immune system to fight it off. Also, patients with CLL don't respond well to vaccines, particularly if they're on treatment or they've had recent treatment, because they can't make antibodies very well, and that's what's required to have a response to vaccines. So for that reason, patients with blood cancers, and specifically CLL, are having a hard time getting on board with the changing guidelines related to COVID-19. I think it's really important for patients with CLL to understand their particular environment or area where they live. What are the COVID rates like? What wave are they in? And what vaccines and treatment options are available? Because that's really key to navigating their particular situation. In Canada, and specifically in British Columbia, for example, all CLL patients are eligible for a fourth COVID-19 vaccination, which means a second booster after 2 initial doses. And so I encourage all my patients with CLL to get fully vaccinated, as even though they may not produce antibodies the same way as someone without CLL, we know that with repeated exposure to vaccines, their antibody levels will go up. It's also important to understand that treatment is available for COVID-19, which works best if taken within the first few days of having symptoms. So it's important for patients to be aware of that and to let their hematologist or oncologist know if they were to contract COVID-19, even if the symptoms are mild, as the whole point of these medications is to help prevent progression to more severe disease. It's also important to understand your region's public health recommendations, and knowing that patients with CLL are at higher risk than the general population. So they may need to do a little bit over and above the current public health recommendations, especially as for the general population, things are backing off. But it always is an individual decision, and patients can make the decisions for themselves in terms of what measures to keep continuing with. For example, wearing masks, of course, hand washing is very important, and staying away from people who are unwell. Consider CLL patients on World CLL Day.